My inspiration for the VNA came from my grandmother. She was a really remarkable woman. And in her last few days here on earth, my mother, my sister, and I were sitting bedside with her. And at some point, the doctor came to us and said, we need to bring hospice in. And it was very difficult for us to decide that, someone else was going to be there instead of us. But I called our friends up at the VNA, and within an hour, this woman showed up. And she sat with my mother and my sister and I for a very long time. And she just asked us questions without feeling intrusive. She just made us very comfortable because we didn't want to leave my grandmother. We didn't want her to go without one of us being there. And it was very emotional for the three of us. But she looked at us after a little while and said, you all need to go home. You need to come to your husbands and your children and your family and just spend some time with them. Your grandmother knows she's hovering, and your mom, and she said she's not going to go. And she was right. She was so dead on right about my grandmother, because that's the type of person that she was. She would have never wanted us to have her leave while we were standing there. And so we all left and went home, and at 4 o'clock we got the call in the morning. Got the call in, she had passed, but we were all okay with it. We knew that the person that was sitting there with her, holding her hand, was caring and involved, and knew what it would be for us to know that she left when all of us weren't there to be with her. And after that, it was really powerful. And it took me a little while because my kids were younger and they were busy and everything, but at some point, I finally called my good friend, Bill Egan, and said, listen, I need to do something. I need to give back to this amazing organization. And he got me a gig at the thrift shop. And that's how I started. But over the course of the years, Kevin's father had to go on hospice, and we have used the VNA services for his mother for numerous things. So they've been there for us on so many different levels, and so many crucial times in our family. It's funny, the thing about the VNA is you really never know that or what it is until you actually need it.
What inspired me to be involved in my community really was early on through my parents, who always taught us that we should give back. And by the time I reached college, I had done community service all through college. It's where I met Laura, was in the community service organization we both belonged to. So we've always been involved in our community, and always been involved in, whether it's through our children's schools, whether it's through things that interested us, and especially when Laura's father became ill, that's when we found out about the VNA. When he became very ill and hospice had to come in, we were very impressed by the care. And in fact, we were amazed. We didn't know how people could do this on a daily basis, because you're going through a situation yourselves and you realize how hard it is, and it's like, oh my God, someone does this for a living. This is amazing. These must be amazing people. We actually saw the real benefit of the organization, and it's one of those things. It was a life event that made us realize, oh my God, this exists in our community. We should be involved in helping.
I am an RN. I'm also certified in hospice and palliative care. I am the case manager currently for the Medicare Care Choices model. It's for patients who are hospice eligible but still seeking aggressive treatments.
When you're a hospice nurse, it's about quality of life. And you want to give patients and families and help them through whatever time they have left and give them whatever quality they can.
The team that I work with is very supportive. And team being fellow nurses, social work, pastoral care, supervisors, from everyone, home health aides, everyone supports each other and works well together. It's bittersweet, but you have that reward that you're able to have people move on comfortably. As much as you try to separate yourself or guard yourself and not be touched, there's those patients and families that really hit you. It's end of life, so you get close real fast sometimes.